من MCK Group. راغدة جمال، معلش يا راغدة.
Assalamu alaikum. I'm Raghda Gamal, radiology resident at Ain Shams University. I'm here to present to you an MSK case under the supervision of Dr. Rahma Barghali and Professor Dr. Khalid Ali, the mentors whom I'm grateful for. Okay. A 48-year-old female patient presents with back pain, low back pain for a few months. She's referred from her physician with an X-ray that showed diffuse multifocal sclerotic bony lesions. So a CT was requested. Her CT showed, the lumbosacral CT showed multifocal diffuse sclerotic bony lesions, both in the vertebral bodies and the pelvic bone. Do you have any differential diagnosis for this case? Anyone? Yes, it could be metastasis. Bone tumors in general could be primary, it could be metastatic, it could be hypervitaminosis D, hyperfluorosis, or hyperparathyroidism. Her soft tissue findings were splenomegaly and generalized lymphadenopathy, paravertic, splenic, celiac, and also examination showed cervical, enlarged cervical lymph nodes. Does this change our differential diagnosis? Maybe tumors, maybe systemic diseases. So an MRI was requested, which showed multiple vertebral body lesions, which showed low signal in T1, high signal in both T2 and STAIR, with geographical appearance and double line appearance, which is pathognomonic of osteonecrosis or bony infarction. So what could possibly relate the presence of generalized lymphadenopathy, osteonecrosis, multiple sclerotic bony lesions? It actually was very confusing. So upon inquiring more of the history from the patient, she told us that she has been on long-term steroid therapy for an unknown reason. Her physician told her to take it, but she doesn't know the disease. We ordered some more tests for her, which showed elevated angiotensin-converting enzyme. This is a very characteristic sign for the presence of sarcoidosis. So we must know that sarcoidosis not only presents with its common manifestations, it also has musculoskeletal manifestations, which could affect the joints, the bones, the muscles. The most common of which is the affection of the joints, mainly affecting the joints of the hand, ranging from the presence of a chronic non-erosive polyarthritis up to a deformity, Jacob's deformity. It could be isolated, or it could be a part of Lofgren syndrome. Also, it can affect the hands in the form of lace-like pattern of the phalanges or taking a tubular form. It could affect the muscles, ranging from a proximal myopathy. It also can affect, which is the rarest manifestation of the sarcoidosis, is the presence of bony lesions, which could be cystic, and the rarest finding is the presence of diffuse multifocal sclerotic bony lesions. The second take-home message, which is the most important message in all medicine, which is that the medical history is an important cornerstone in the radiodiagnosis. Thank you.